Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor briefing his colleague about a patient. Now read the question.
Have you got a list of all the patients and locations?
Yeah. Who is our sickest patient?
Mr. Marcel is the sickest patient. He is a 36-year-old male with a ruptured appendix awaiting OR. He became sick over the last 48 hours with worsening abdominal pain, nausea and vomiting. We gave him fluids and brought antibiotics.
Which antibiotics and how much fluid?
Piptazo with 2 liters of normal saline so far. Imaging showed a ruptured appendix with free air under the diaphragm. I would keep a close eye on him.
Have you drawn blood cultures?
Yes. But they were drawn about an hour after antibiotics were started.
And what are the plans if there is a delay in surgery?
I haven't spoken to ICU yet, but he might need to go there if his condition worsens while he is waiting for the OR. Sound good?
Yeah, I'll speak to ICU as soon as we're done here.
Question 26. You hear part of a surgical team's briefing. Now read the question.
She currently only has intermittent late decelerations, and these have improved with her position changes and supplemental oxygen. We'll monitor her until she's fully dilated and allow her to push.
If there's any evidence of fetal distress or persistent late decelerations, we should be prepared to go to C-section.
I've alerted the OR to be prepared in case we need to use them.
Great, I'll discuss this plan with Mrs. Aldrich, and we are done here. What are her vitals right now?
Normal. I just checked 15 minutes ago. She had no late decelerations since you were called.
Let's continue to monitor her. I need to know when she's complete and pushing so we can keep a close eye on her second stage.
Question 27. You hear a radiologist talking about a new initiative that has been introduced. Now read the question.
This is a big, ambitious project. We're going to focus on patient flow through the system right from the very start. When a patient sees their commission and they require support from radiology with imaging and they make a request, we want to get that request from imaging as quickly and as efficiently through the system to the reports available to the commission so they can make the appropriate management plan and take the patient's clinical journey forwards. This is an ideal opportunity now to really embed some forward behavior, where we're learning together, we're developing together, we're looking at creating where we have today's work completed today, that there's no delay, so we're really improving the services to our patients. We are all taking control, we are all involved, and we will be proactive and not reactive, so we have analyzed CT and MRI services. We have outlined and prioritized areas for further improvement, and you can make a difference.
Question 28. You hear a pharmacist talking to a doctor regarding a patient's medication. Now read the question.
Hi, Dr. Marcy, is this a good time? I need 2 minutes to discuss about Mrs. Samuel. I'm Harper and I'm providing pharmacy coverage to the unit.
I have a few minutes. What's up?
Nursing raised a concern from rounds this morning. The situation is that Mrs. Samuel's pain isn't being well controlled. She's sedated, which is having an impact on her participation in therapies, and she's continually reporting her pain at 8 out of 10.
Okay. What's the background of the patient?
She has fallen 3 times since her admission to rehab, and she's requesting to go home at her first pass this weekend, some big family anniversary. But my assessment is that we are not adequately controlling her pain, and what we're giving her is contributing to these falls.
Okay, so what do you recommend?
Well, after reviewing her chart, I'm considering lowering her dose of opiates and introducing an anti-inflammatory which would be less sedating and she should be able to tolerate.
Yeah, that makes sense.
Her husband is coming in this Tuesday at 9 a.m. If you're available, we could meet to discuss.
Okay, sounds like a good plan. Let's meet back here and we'll talk to the family together.
Now look at question 29. You hear an optometrist talking to a patient. Now read the question.
Mrs. Wilfred, what brings you here today?
I am having trouble with my vision. I can't see and I need new contacts.
Okay, are you having trouble seeing up close or far away?
I can't see anything. I'm night blind and my eyes very itchy now. I brought my glasses with me and I want you to check them.
Okay, let me check your glasses. I will show you some lenses and just tell me if one of these lenses makes these letters look better.
These aren't working.
Okay, now I'm going to check the health of your eyes. It looks like you have a detached retina and contacts will not help in this situation. You need a surgery.
Can I get glasses instead?
No, ma'am, the problem that you are having now will not improve by using glasses.
Can you give me some drops for few months?
No, ma'am, drops will not help with your detached retina.
Question 30. You hear a podiatrist talking about a proposal to offer help with dialysis patients' foot care. Now read the question.
For the last couple of years, we were aware that a lot of the patients who underwent dialysis were at really high risk of developing complications with their feet, especially the diabetic patients. We found that a lot of them were struggling to attend our clinics and access the service. We had to come up with an ingenuity project to try and improve an element of care, and we thought this was a brilliant opportunity to look at the problem that we already identified and see if we could come up with a solution for it. So, we are offering our service to the people who would find it difficult to access our service. It would be really nice as we're making a difference to their life because they don't have to go out on their day off, and they go out 3 mornings a week, and when it's freezing cold.
That is the end of Part B. Now look at Part C. Part C. In this part